So we're going to clean our hands and set up our sterile field. First thing we have to do is put out our sterile drape. So we're going to open that package. When removing our sterile drape, we want to make sure we're only grabbing it by the edges. We have a 1-inch border in order to hold on to our sterile drape. And we want to just work our fingers along the edges, not shake the drape, but let it just come out down on its own. And then when we lay our drape on the table, we want to make sure our table is clean and dry. And we lay it away from us and then down onto the table. If we were to accidentally lay a piece of our drape over the edge of the table, we are not going to move it back onto the table. That piece of drape is no longer going to be sterile, and we will just leave it where it lays. The next thing we're going to do is add our supplies to our sterile field. When opening any supplies, you want to make sure you're holding them about 6 inches above your sterile field. You're going to be opening the package away from you. Being careful not to touch the inside of the package. You want to make sure to try and get all of your supplies in the center of your sterile field, because that 1-inch border is not sterile. When opening our boat of gauze, we want to make sure not to touch the inside of the packaging, because we are going to use that for our sterile solution. The next thing we are going to do is put our sterile solution into our sterile boat. We're going to open our saline bottle. We want to make sure that we are holding the label to our palm. And when we pour our saline in, we want to use a technique called lipping, where we're going to twist the bottle in order to make sure that the saline is going into the boat in a sterile fashion. So just gently turning the bottle, and then we will replace our cap. So we have our sterile field completely ready, and we are ready to go over and put the wet dressing into our wound. We want to apply our sterile gloves next, and also make sure that if our patient required any pain medication, that they have been pre-medicated for this dressing change. We also want to make sure that when getting new supplies, we never reach over our sterile field. If we were to reach over or turn our back on our sterile field, it is no longer considered sterile, and we would have to begin again. So we have already undressed and assessed our wound, so we're going to begin by placing the new dressing in. We're going to take our sterile gauze that we have placed on our sterile field and put it into our solution. We want to make sure that we wring out any extra moisture. We don't want the wound to be soaking wet. Once we've done that, we want to make sure we're not standing right over our sterile field so we don't drip any of the solution on it. And we want to open up our gauze. As you can see, as you're opening the gauze, some of the edges are a little frayed. So we want to take those edges and fold them in so that we don't get any little pieces of gauze stuck in the wound bed. So we go around to all 4 sides and simply fold those edges over to make sure that any of the little pieces of fiber don't get stuck in the wound. Once we've completed that, we're going to fold the gauze up into your non-dominant hand, leaving a little tail at the end. And we're going to pick up our sterile applicator, which we are going to use to pack our wound with. We want to make sure when we're putting our dressing in that we're not touching the outside of the wound with any of our sterile dressing that's to go on the inside. So using just a small piece of the tail in our sterile tip applicator, we're going to work on just guiding that gauze into the wound bed. Working it back and forth. We don't want to overpack a wound. We want to kind of keep the gauze a little bit fluffy so that the wound has a chance to heal. If we overpack that wound, we are pushing down all that good tissue as well. So we want to just kind of keep it so that it's nice and fluffy and not pushing too hard into that wound. So once we have placed in the wet, moistened gauze, we have to cover our wound with some dry gauze. So we will take our dry, sterile gauze and place it over our wound. The last step is going to be to tape the edges of our sterile dressing down in order to secure it to the patient's skin. We will just use whatever tape is ordered for that patient, and we want to make sure that we have a date, time, and initial on that tape for when that dressing was performed.
The sterile portion of the dressing change is done once that outer gauze is placed over.
We want to try and keep the tape as wrinkle-free as possible, protecting the patient's skin. You will then clean up your supplies and you will be finished with your sterile wet to dry dressing.